A brain aneurysm is a condition where a weak spot in the wall of a blood vessel in the brain bulges or balloons out, resembling a small balloon or berry hanging on a stem. This bulge can vary in size, from as small as a few millimeters to as large as several centimeters, and it occurs because the blood vessel wall has become thin and weak, which can be due to various factors we will get to in a minute. Brain aneurysms are particularly concerning because they can rupture, leading to a hemorrhagic stroke, which is a type of stroke caused by bleeding into the brain. A ruptured aneurysm is a medical emergency and can lead to severe neurological damage or even death. Brain aneurysms can occur anywhere in the brain, but they're most common in the arteries at the base of the brain. This area is called the Circle of Willis, named after the English physician who first described it. The Circle of Willis is a network of blood vessels that supplies blood to the brain and surrounding structures. So, how common are brain aneurysms? Well, you might be surprised to learn that they're more prevalent than many people realize. It's estimated that about 3 to 5% of the general population have or will develop a brain aneurysm at some point in their lives. That's roughly 1 in 50 people. However, it's important to note that most brain aneurysms don't rupture or cause any symptoms, so they remain undiagnosed. The prevalence of brain aneurysms increases with age, and they're more common in women than in men. Some studies suggest that women are 1.5 to 2 times more likely to develop a brain aneurysm than men. Types of brain aneurysms. The most common type of brain aneurysm is called a saccular aneurysm, also known as a berry aneurysm due to its shape. It resembles a small, round fruit hanging from the blood vessel by a narrow stem. Other types include fusiform aneurysms, which cause the blood vessel to widen all the way around uniformly, and mycotic aneurysms, which are caused by infections. Causes of brain aneurysm. The exact cause of brain aneurysms is not fully understood, but several factors can contribute to their formation. One significant factor is congenital, meaning that some people are born with an abnormal weakness in the walls of certain blood vessels, making them more susceptible to developing an aneurysm over time. Certain genetic disorders can also increase the risk of developing brain aneurysms. For example, polycystic kidney disease, which is a condition characterized by the growth of cysts in the kidneys, is associated with an increased risk of aneurysm formation. Connective tissue disorders like Ehlers-Danlos syndrome, which affects the body's collagen production, can also make the blood vessels more fragile and prone to aneurysms. High blood pressure, or hypertension, is another major risk factor. The constant force of blood pushing against the walls of the arteries can, over time, weaken these walls and lead to the formation of an aneurysm. This is why controlling blood pressure is crucial for preventing and managing brain aneurysms. Smoking is a significant risk factor for both the development and rupture of brain aneurysms. The chemicals in cigarette smoke can damage blood vessel walls and increase blood pressure, both of which contribute to aneurysm formation. Age is another factor to consider. As we get older, our blood vessels naturally become less elastic and more prone to weakening. This is why brain aneurysms are more common in older adults, typically becoming more prevalent after the age of 40. Other factors that may increase the risk of brain aneurysms include excessive alcohol consumption, drug abuse, particularly cocaine use, and certain infections that can affect the blood vessels. Additionally, infections affecting the blood vessels, known as mycotic aneurysms, can occur when bacteria or fungi invade the blood vessel wall, weakening it and leading to an aneurysm. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of brain aneurysm. The symptoms of brain aneurysms can vary widely depending on whether the aneurysm has ruptured or not. For unruptured aneurysms, many people might not experience any symptoms at all, especially if the aneurysm is small. However, if an unruptured aneurysm grows large enough, it can press on surrounding brain tissues and nerves, leading to various symptoms. One of the most common symptoms of an unruptured brain aneurysm is pain. This isn't just any headache, but a specific pain that often manifests above and behind the eye. It can be persistent and may not respond well to typical pain relievers. Along with this pain, some people might notice changes in their vision. They might experience double vision or other visual disturbances, which can be quite disconcerting. In some cases, an unruptured aneurysm can affect the nerves that control eye movement and facial muscles. This can lead to a drooping eyelid or weakness on one side of the face. Some individuals might also experience numbness or even paralysis on one side of their face. The situation changes dramatically when an aneurysm ruptures. A ruptured brain aneurysm typically announces itself with a sudden, excruciating headache. Many people describe this as the worst headache they've ever experienced in their lives. It's not a gradual buildup of pain, but rather a sudden thunderclap headache that reaches maximum intensity almost instantly. Accompanying this severe headache, many people experience nausea and vomiting. Another common symptom is a stiff neck. The bleeding from the ruptured aneurysm irritates the meninges, which are the protective layers around the brain, causing them to become inflamed and leading to neck stiffness. Vision problems are also common with a ruptured aneurysm. People might experience blurred or double vision, or they might become extremely sensitive to light. Even normal indoor lighting can feel painfully bright. In severe cases, a ruptured aneurysm can lead to seizures, stroke, or coma. The symptoms of a ruptured aneurysm are a medical emergency, and quick action can be life-saving in the case of a ruptured brain aneurysm. Diagnosis of brain aneurysm. Diagnosing a brain aneurysm can be challenging, especially if it hasn't ruptured and isn't causing symptoms. When a doctor suspects a brain aneurysm, they typically start with a thorough medical history and physical examination. If a brain aneurysm is suspected, imaging studies are typically used to confirm the diagnosis. One of the most common imaging techniques is a computed tomography scan, which can quickly detect bleeding in the brain caused by a ruptured aneurysm. If a CT scan is inconclusive, a lumbar puncture or spinal tap may be performed to check for blood in the cerebrospinal fluid, which can indicate bleeding in the brain. Another imaging technique used to diagnose brain aneurysms is magnetic resonance imaging or magnetic resonance angiography, MRA. MRI provides detailed images of the brain and blood vessels, allowing doctors to visualize the aneurysm size and location. MRA, on the other hand, is a type of MRI specifically designed to visualize blood vessels. This is particularly useful for detecting smaller aneurysms that may not be visible on a CT scan. In some cases, a cerebral angiogram may be performed. This procedure involves injecting a contrast dye into the blood vessels and taking X-ray images to map the arteries and veins in the brain, providing a precise view of the aneurysm. Treatment for brain aneurysm. The treatment approach depends on several factors, including the size and location of the aneurysm, whether it has ruptured, and the overall health of the patient. For small, unruptured aneurysms, a doctor might recommend a watch and wait approach. This involves regular monitoring with imaging tests to check if the aneurysm is growing. The patient will also be advised to control risk factors, such as high blood pressure, and to avoid activities that could increase the risk of rupture. For larger aneurysms or those at high risk of rupturing, more aggressive treatment is usually recommended. There are two main surgical options for treating brain aneurysms. The first is surgical clipping. In this procedure, a neurosurgeon makes an opening in the skull to access the aneurysm. They then place a tiny metal clip at the base of the aneurysm to stop blood from flowing into it. This effectively cuts off the aneurysm from the blood vessel, preventing it from growing or rupturing. The second option is endovascular coiling. This is a less invasive procedure where a thin tube is inserted into an artery, usually in the groin, and threaded up to the brain. Tiny platinum coils are then passed through the tube and into the aneurysm. These coils fill up the aneurysm, causing blood to clot and effectively sealing off the aneurysm from the rest of the blood vessel. For ruptured aneurysms, emergency treatment is crucial. The first priority is to stop the bleeding and prevent further damage to the brain. This often involves a combination of surgical intervention to repair the aneurysm and supportive care to manage complications such as increased pressure in the brain. In some cases, medications may be used to manage symptoms and prevent complications. For example, calcium channel blockers may be prescribed to reduce the risk of vasospasm and anticonvulsants may be used to prevent seizures. Pain management and blood pressure control are also essential components of treatment to reduce the risk of further bleeding or damage to the brain. Now we want to hear from you. Have you or someone you know ever experienced a brain aneurysm? What treatment did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.